All right. Okay. Well, welcome everyone. Thank you so much for being here and being available to listen to our first SCCA Advisor Program Patient and Caregiver panel. My name is Tiffany Go. I'm the Program Manager of our Patient and Family Advisor Program, and I'm joined today with our lovely panelists and advisors who will be sharing their stories and their experiences in being part of the Advisor Program. A little bit about SCCA's Patient and Family Advisor Program. Our advisors are a resource to the organization for volunteers. So they serve on various different committees, different work groups. They provide insights and participate on different projects. And they provide their input on surveys and any type of feedback that our patients and families see and interact with. The biggest part of our advisor program is improving that communication between staff, patients, and families, and providing input in the development, implementation, and evaluation of SCCA programs, policies, and services. Today, we are joined by Rosie Barra, Hillary Miller, and Ricardo Parker. And each of them will go ahead and introduce themselves and share a little bit about their story. And I would like to introduce Rose to share who she is and how she came to the SCCA. Rose?
Hi, thank you. My name is Rosie Barra. I have been a patient advisor for just a couple months now, but I've been a patient at SCCA for about 10 years. When I was 25, I was otherwise very healthy, had a very passionate career going, working in journalism. Things were going really well. And then I started having this sort of mysterious but very intense back pain. Because I was 25 and active and otherwise healthy, it took a while to figure out what was going on. But after a MRI ordered by my primary care provider, we realized I had a large tumor on my spine. From there, I was referred to a oncologist outside of SCCA. And unfortunately, I had sort of a challenging care experience there. The prognosis was, from their perspective, was really poor and created a lot of anxiety and fear for myself and my family. Thankfully, they referred me to SCCA, and that was one of the most amazing turns sort of in my cancer journey. Once I got to SCCA, I was diagnosed with acute lymphoblastic leukemia, and my oncologist had a completely different perspective. He offered myself and my family a lot of hope, let us know that I had an 85% chance of going into remission and staying in remission. And so after that, I went through about 6 months of really intensive chemotherapy, but came out of it sort of ready to get back to my life and ready to move forward. I got married shortly after and continued working professionally, but shifted to healthcare communications. My husband and I decided to start our family, and we had my oldest son, Gus, who is now 6 years old. And when he was about 5 months old, something else occurred. I was actually jogging with him, trying to get back in shape after having him. And I was pushing him in the jogging stroller, and I realized that I could not lift my right leg very well. It just wouldn't go. And I actually started crying, even though I had no idea what was wrong. My husband came to me and said, "What's wrong?" And I said, "I don't know, but something is off. Something is wrong." It took a while to figure out what was going on, but it turned out that my cancer had relapsed, and it was very prominent in my central nervous system. So it was causing a lot of nerve damage, which is why I had become weak on my right side of my body. At that point, as I mentioned, my son was 5 months old. I was a new mom. I knew a little bit more about cancer, so I knew that this time around was going to be very different, and that it would be more difficult to treat. And that was terrifying for me, especially as a new mom who had this little guy that I did not want to leave. The thing that gave me the most comfort and hope was being at SCCA. I trusted my providers entirely. And I just found comfort in the care setting there. Everybody that took care of me was so kind and compassionate, and really helped me in what was most certainly the most difficult time of my life. I went through chemotherapy, radiation, and bone marrow transplant, which was very intense. I am now 5 years out from that transplant, and thankfully have been in remission ever since and have gotten back to being healthy. They said my son is now 6 and we have another son who is 2. So yes, I'm just really, really grateful to be here and credit so much of my current state and my health to SCCA.
Thank you so much, Rose, for sharing your story. And I would love to invite Hillary, who's actually a caregiver of one of our patients at the SCCA. Hillary?
Yes, I guess I fall into 2 categories as I was a caregiver. I'm also a bereaved caregiver, and the Keith passed away from cancer last year after about a 6-year journey with cancer. Thankfully, all at Seattle Cancer Care Alliance. It was just an amazing experience and made the best of the situation. So yeah, similar. It started, Keith and I were both working full time. Our daughter was, I guess, in high school at the time, 6 years ago. And he had just some weird intestinal discomfort and went to his primary care physician after a couple months of tests and thinking it was gallbladder or kidney stones or something like that. I can vividly remember the week, it was right before 4th of July weekend. We were in the car when his gastroenterologist called and said, I think it's cancer. We've eliminated everything else that it can be. Come in next week and we'll talk about options. And I, being sort of the researcher, deep dive, immediately went to the library, got as many books about cancer as I could, trying to research everything, and mostly about how to help manage this journey. And the pivotal question at that first meeting with his gastroenterologist, when he said, there's a couple different choices you have for cancer treatment in the Seattle area, I said, where would you go? And he took him out, but it basically talked about the partnership with UW and Seattle Cancer Care. And I'm so happy that he pointed us in that direction, because over time, Keith had surgery, then oncology, radiology, and we had, again, a great experience that put him into remission for 3.5 years. And even when there was metastases and we knew it was a terminal diagnosis, he had almost 2.5 years, and they made that experience so amazing for us. And as a caregiver, I wanted to help advocate for Keith and participate. And Seattle Cancer Care was so amazing, from the schedulers who worked with us and our work schedules so that his appointments could better flow, because he was still able to work for almost the entire journey. Introducing us to the social worker and understanding all of the opportunities that I wouldn't have known about that would help us in that journey. The chaplaincy, even though we're not especially involved in organized religion, the non-denominational chaplains that would come and talk to both of us. The resource center, because again, as always wanting information to make sure I knew every possibility, so Keith didn't have to worry about that. So I just was so impressed by all of the resources that Seattle Cancer Care has, how integrated they are. But probably the most important thing was the time, because I always felt like people took time for us. Neither one of us felt rushed. If I had a lot of questions for his oncologist, or he did with a nutritionist, everybody felt like we were their only patient and the only family that they were seeing. And so when the opportunity came to be an advisor, I absolutely wanted to participate in ways that I could help pay forward the incredible generosity and kindness that we were shown through those years.
Thank you so much, Hillary. And Ricardo, would you please also share your story? Oh, and you are still on mute, Ricardo.
Thank you. You hear me, right? I'm Ricardo Parker. I'm originally from Brazil. I moved to the United States in 1996 when I was 20 years old, and I am 46 now. I have had a very healthy life. I've always been very active, and I used to play soccer twice a week. And when it was I must have been 36 years old, I started having a problem on my foot. And at the same time, I was getting a lot of pressure as an entrepreneur, which I am, to be dedicated to my company. So I stopped playing soccer, but it was in part because I had this pain on my foot. And I went to see the doctor, And the doctor said that it was nothing to worry about. And in fact, I had seen the doctor for a checkup the week before. So it was almost like he was saying, why are you here when you're so healthy and you don't have any reason to be here? It was kind of an odd experience, but I just took from that it wasn't really anything that I had to worry about. And years went by, and I had this lump that was growing on my foot, and I went to see another doctor, and the doctor said that it was benign and it was really simple surgery and that it was nothing to worry about. And I was really busy building my company with a lot of things going on. So I came home and I thought, this is something I'm going to get to, but it doesn't seem like it needs to be dealt with right away. And there's the possibility that it'll go away because it's just a benign cyst, or so they tell me. Anyways, a few years went by and I started having a lot of pain that was actually happened very quickly. I was having trouble sleeping and walking. And long story short, I went to a clinic, which the woman wasn't even a doctor. She was a nurse practitioner. And she referred me to UW Medical. And then very quickly I ended up with a doctor at Scca. And he gave me the diagnosis that I had this very rare type of cancer. That was a very shocking thing for me because I just never thought I would have cancer given my lifestyle. And I just try to do everything healthy. And so very quickly we had biopsy surgery to confirm. And then the conversation switched to my having to have surgery and whether I was going to get to keep my foot or not. And I remember very well the moment when it happened where I have this experience that the doctor was even on his knees, which is so remarkable. But I said, I don't want to talk about amputation. I want to have my foot. I mean, I've been healthy all my life. In my mind, this was not even going to happen. And he said, we do what the patient chooses. And they did really extraordinary work for me to be able to walk again and keep my foot. And I went through 3 surgeries. I was in the hospital my surgeries lasted about 35 hours in total. But it was really a remarkable work the teamwork that I experienced at Scca was just so incredible that for me, it was just a really amazing experience. And I loved every moment that I was in the hospital, which is kind of odd to say, but it was just a positive experience every single moment. And so I had this opportunity to become a patient advisor, and I wanted to do it because I've never felt really connected to the medical world. I work in tech and I don't really work on anything medical. And I've always wanted to. I think it's very noble work. And also, I really, really believe that there are a lot of people out there that are healthy, and it's only a matter of time until they get a diagnosis for something that they never planned on having, and they never thought it would happen to them. And somehow, because of the people I've had in my life, and including the Scca and the staff at Scca, I had a positive mindset from beginning to end. And I do think that plays a major role in the outcome. I remember everything that was said to me. And the doctor one time said, what you have is actually very aggressive. But I had it for over a decade, and it didn't kill me, and I just want to be able to help other people so they can continue living. I have an 11-year-old daughter, and she's my reason for living. And I've been able to be her father, and still walk. And I owe all of that to the clinic and all the people that work there. As I see it, I just love all the doctors and everybody. And I just want everybody to really have a positive experience and a positive mindset.
Thank you so much, Ricardo, for sharing your story, and for all of you for sharing how you got to Scca. And one of the biggest themes that I'm pulling out from all of you is at any time, things can change and become a new normal. And you're healthy until you're not, is also the message that I'm also hearing from all of you as well. I know that Hillary, you touched upon this kind of following up on Ricardo's comments about becoming an advisor. But can you expand a little bit, just because of your dual role as a caregiver and of a bereaved caregiver, and just what compelled you to want to serve as an advisor?
I mean, I didn't know that the advisory council existed during our time there. We were just busy with other things. And again, it was our social worker that explained this opportunity to give, a perspective on what our experience was. And I think I definitely leapt at the chance, partly also because my day job is in marketing and advising clients. And it's all a form of communication. And is understanding that advisory council can help say, how would this message land with you? And as when you were a patient or a caregiver, would this resonate? Are there hot buttons that we should watch out for? I just thought, when I understood what the council did, I thought I was so happy again, like, oh, no wonder SCCA has been such a great experience, because they're so thoughtful about keeping the patient at the center of these, maybe sometimes seemingly like fairly disparate decisions. And so I thought I would happy to give my perspective, partly because I think I like to stick my nose into a lot of things. And I was always asking, can we meet with a nutritionist? How does this work here? And everybody was so forthcoming. So I feel like we touched on a lot of different aspects of SCCA over the 6 years, and even through a terminal diagnosis, and how I think that's a much smaller subset, but how everybody held space for us, both of us, not just Keith. I mean, it was definitely him, but as a family member and our daughter as well, making sure they knew resources for her. So I just love that opportunity, and wanted to again say how I can help where relevant in the experiences that I have.
Thank you so much, Hillary. And what about you, Rose? From starting your journey from 2011 to 10 years later today, why did you want to serve as an advisor?
Yeah, I think since very early in my time as a patient at SCCA, I have really, for lack of better words, kind of been a cheerleader for SCCA. If anybody I knew was diagnosed or going through cancer treatment, while I would never advise anybody on what they should do, I often, and I think almost always, asked, have you gone to SCCA and gotten an opinion there? Have you looked into this? Because if I've learned anything about sort of the cancer world, especially locally, it's just the incredible care that SCCA offers. So I've always been sort of a unofficial advocate for SCCA. And I happen to work at Seattle Children's, and I had the opportunity to work with the patient and family advisors there. And in working with them, I often thought to myself, I would love to do this for SCCA, because that is my medical home. And so when I found that I was in a good place to do so, I reached out and connected with Tiffany, and it's been a wonderful experience ever since. I could not say enough wonderful things about SCCA, but I also believe every organization has room for growth. And I believe the patient perspective is really valuable, and that every one of us has a different experience. And I really felt like I might be able to offer something to help the organization grow from my experience.
Thank you so much, Rose. Ricardo, I know that you spoke about the reasons why you wanted to join from your positive experience. And I'd love to actually ask you, since becoming an advisor with us last year, and virtually also, which is very different, can you speak to what you've enjoyed about being an advisor, or any of the advisor activities that were most meaningful for you?
Could I speak about the activities that I've had?
Yes.
I feel like I haven't, to be honest with you, Tiffany, I feel like I have a lot to give as a patient, as Rose was mentioning, but I haven't really had the opportunity yet. We've had the pandemic and things have been different, but I'm just looking for a way to really make a difference with people. And I think that the staff at SCCA is really extraordinary. But I also think that it's good to have the patients being able to offer their perspective with the staff listening to what really made a difference for them and will make a difference for other patients. I think that's really important. So I'm just trying to play that role, especially because I had such a wonderful experience, I think. So it just might be as simple as keep doing what you've been doing, right?
Mm-hmm.
But like you guys mentioned earlier, every case is different too. And for me, you know, I think that cancer is such a deadly thing that there's a stigma associated with it, you know. And I talked to somebody in my life that basically after I announced that I was dealing with it, it was almost like having to tell everybody that I was going to die. And I didn't feel that it was going to be the case. But a lot of people go in that direction, right? You need to talk to everybody because, you know, you're not going to have a chance. And so who knows what people are dealing with. But I would like to be that person that helps them to just stay positive because it does play a role in the outcome as I see it.
Mm. Yeah, thank you so much, Ricardo. And you're totally right. Being an advisor in a virtual world is so different than what we've been doing in person. And I know that for me, I'm looking forward to bringing everybody back in person so we can start working with our other staff members and our providers, and really lending those experiences that you have into really improving that care for everybody. And it's been great when you've been available to answer emails and to, you know, participate in surveys, even though it's not quite the same as, you know, being with other staff members. So I really want to say thank you. And would want to actually ask Hillary. Hillary, you've been kind of in the same, because you and Rose also joined since we've been during COVID pandemic, and you've also participated in a few things here and there. But what have you enjoyed the most about being an advisor, or any particular activities that speak out to you?
Yeah, I mean, I think the communication has been great, getting the monthly newsletter and understanding what opportunities, and then, you know, seeing if my experience is the right fit for a panel. But yeah, being able to answer surveys, look at website pages, all of those just help because I think, again, my sort of advocacy is just amplifying. There are a lot of great resources at Scca, but not every family knows about them. So how are ways for those different aspects to surface so that everybody who wants to capitalize on getting the full circle support team knows about it. So yes, I look forward to times when we can be in person. I think especially to talk to staff, because I hope that, you know, I think sometimes the frontline people really hear it, but it is like the schedulers, the people who worked at the cafe. I don't know, like there's so many people who made our day. It was just that every time we crossed the threshold for a treatment, because it's Seattle Cancer Care Alliance, everyone held space that they knew you were there with a scary diagnosis or treatment. And I think went out of their way to make us feel safe and noticed and heard. So it would be great to be able to see people in person and thank them for that experience.
And what about you, Rose? You've only been an advisor with us for the last couple of months, but how's it been like for you, and what are you enjoying?
Yeah, as you said, I'm a pretty new member, but one of the things I really love about being a member of this group is there is a sense of camaraderie and being able to relate to one another, even when we're not able to be in the same room. I'm very much looking forward to being in the same room, but even when we're not able to, it's, I think that our meetings create this unique space where we can each really reflect on our experiences and share them in ways that we may not have the opportunity to do otherwise. I always feel really heard in these meetings and conversations. And I find it really meaningful to answer questions about patient care, to give my perspective. I believe that somebody else probably did that before I came to Scca, and that helped make my experience really incredible. And I, you know, as I mentioned, I always recommend and encourage people to look at Scca if they are facing a cancer diagnosis. If anybody I love, which is, you know, quite likely to happen, ends up with cancer and ends up at Scca, it's important to me to know that I did experience too. And I really get the sense that as a team, as a group, that we're doing that.
Thank you so much, Rose. And I really want to thank you all, Ricardo, Rose, Hillary, for sharing your experiences and giving us your time and joining the advisor program, sharing about your experiences so far in the advisor program. And just not thank you for today, but just thank you for your active participation. I just would love to close this panel for those who are listening in, watching, that you can learn more about our advisor program on SCCA's website. I know that Ricardo actually has his story on SCCA's website. So feel free to search for him and his story there. And I'm looking forward to sharing more about the advisor program and other SCCA platforms as well. Thank you so much, everybody, and have a great rest of your day.